Okay, welcome. It's me again. So today, if you weren't here yesterday, my name's Nikki, and I had a son with Charge syndrome that since passed away, and I've tried to kind of stay a little bit involved with the community. So I'm glad to be here and able to help just a little bit. It sounds like the conference is going awesome. Today we have a panel similar to yesterday, but today we have some Charge moms, which is always a popular panel at every conference I've been at because people like to ask questions and gain a little bit of knowledge from their experience. And so we hope that today that these four moms can provide some perspective and maybe help you sort through some things or reassure you on some things that you are trying to brainstorm on. So we're going to start, just introduce them and I'm going to let them tell you about their charger, their age of their kiddo, and whatever else they want to tell you about themselves, and then we'll get started. You want to start? Or do you? Okay, we'll start with Robin then.
Hi, I'm Robin. I live in, can you guys hear me? Northern Kentucky with my husband, Justin, and we have two boys, Wyatt, who is almost 7 in 2 weeks, and he would want you to know that. And Grayson, who's 3.5, he'll be 4 in January, and he has Charge syndrome. He was born at Good Sam and then transferred to the NICU at Cincinnati Children's when he was 3 days old, and spent probably 2 straight months in the NICU, discharged for 1 week, got rhinovirus, came straight back to the NICU, spent another month or so there, and then we've been home since then, luckily not had to have any inpatient stays other than for procedures or surgeries since then. He was born with a cleft lip and palate. He's profoundly deaf in both ears, not a candidate for cochlear implants, so my husband and I are learning sign language, and he is learning to sign as well. He has, what other things does he have? Lots of other things. He has a minor heart defect, which is just being monitored. He does have T-cell lymphopenia, so he's got a pretty compromised immune system that currently we work with immunology on and just kind of monitor that. So I am a little bit about us, but I'll pass it on.
Hi, I'm Sean Herrick. Sean Herrick, and my son is Cole, and he was here yesterday. He's 13 years old, and then my husband was also here yesterday with him, and then our service dog, or his service dog, also probably my service dog because he gives me a lot of comfort. But anyway, so they were here, and then I have a 4-year-old son who is at home with his other grandparents right now. It was a big success for Cole to be here yesterday because he has a lot of anxiety in new environments, new places, new people. So we made some big goals. He handed out the Frugi packets, which was huge, and he actually spoke to 2 of his doctors yesterday with my prompting. Sometimes I probably prompt too much, but he did it. Let's see. And so then so his medical history, he had a trach until he was 3. He has significant swallowing issues and trouble with chewing, those kind of things. And didn't probably really, we always gave him tastes of things, but probably didn't really eat anything by mouth until 6 or later, and is doing very well with that. He's probably eating most of his food by mouth right now. Let's see. Hearing, he can hear out of one ear with his aided. He wears a Baja, and he does very well with that. He does have low vision. If you ask him, he really doesn't understand his vision impairment. If I ask him and I'll say, you have low vision, and we talk about, I think that's the way he was born, and he just sort of compensates for it and doesn't see the differences. So, and I think that's it for now.
Perfect.
My name is Sally. I don't like talking into the microphone, so let me know if you can't hear me. Malik is my charger. He's 3 years old. He'll be 4 in September. He lives at home with my husband and his big sister, who is 5. He was born here in Cincinnati. When I was pregnant, they didn't really have any idea what was wrong. They thought it was me. They thought maybe it was my blood sugar that was causing all the complications. Malik was transferred to Cincinnati Children's NICU within the first hour and a half of his birth from Christ Hospital. 3 days later, we found out via CT that he had CHARGE syndrome. I honestly can't tell you how many surgeries he had. I feel like Dr. Hart did so many surgeries in the first 7 weeks of his life that I lost count. So his major problems that we were working with is he had a tracheoesophageal fistula, which caused us a lot of fun getting that fixed, bilateral choanal atresia. He's profoundly deaf in both ears. He utilizes a cochlear implant with his left ear and a hearing aid in his right ear. His vestibular system has been a huge challenge for us. He constantly has a head bump or a bruise when you see him, but he is very happy with himself and his balance and his walking. He had a G-tube until recently. We're very thankful that we got that out about 8 weeks ago, and he's been eating by mouth. I will be trying to pass out free G-tube supplies after lunch if anybody is interested. And again, I have lots of medical information on him, but I will pass the mic.
Hi, my name is Ingrid Lobaugh, and we live in Tulsa, Oklahoma. And my daughter with CHARGE is 16 years old. Her name is Anna. She's deaf. We are a signing family. She's not a candidate for a cochlear implant. I have another daughter who is 19. Her name is Rachel. If any of you were at the last international CHARGE conference, she was on the first sibling panel. Thank you. She says it was amazing. Yeah, so y'all know all about my life if you were there. Nothing like handing a sibling a mic. So it's my turn, revenge today. No, Rachel is amazing, very smart. I'm gonna say she is top 12 freshman at OU, University of Oklahoma, not Ohio, Oklahoma. So she's home now finishing up her summer courses. So very proud of her. Go back to Anna. She was at the dinner last night, mostly on her iPad the entire time we were there. She's primarily G-tube fed still. We're pursuing some avenues with more oral eating, but she had some queso last night at dinner. We have had a bunch of weird stuff happen in our lives that aren't supposed to happen, even in the CHARGE world. Like, she didn't have facial palsy at birth. It popped up on one side at 1 month, and then it kind of started appearing on the other. And of course, this was before genetic testing because we're a little bit older than most of y'all. And so we got sent out of state trying to figure out what was going on. And fortunately, we were sent to St. Louis. And back then, before Facebook, there was a listserv, and my husband had been communicating with Meg Hefner, so I called her and said, could you come meet us? Because we were being sent to a muscular dystrophy clinic, and they said, oh, she might have Phaseolande syndrome, which is the child version of Lou Gehrig's, and I don't know, it was very dramatic. And Meg said, yeah, I'll meet you after work. I'll just meet you at your hotel room. I'm really close. And so she came in, and she walked in. Anna's lying on the bed going like this, and she goes, oh, that baby's got CHARGE. And I was like, diagnosis right there, 5 months. So when she turned 4, we were still eating yogurt and pudding and things like that. That was before we got our second G-tube. Food started coming out of her ears. That was a wild experience. That can happen. So also her tonsils grew back. We had a little discussion about that at dinner. That can happen. She had a hiatal hernia where it went on so long. Hopefully this doesn't happen anytime in Cincinnati, but her bowels grew up and her colon grew attached to her heart, and every time she ate, she threw up. That was a scary time. So also just recently learned, like, long-term, this was Monday? No, I don't know what day it is, Wednesday. Her long-term CPAP use has made her upper jaw kind of collapse, and so now we're looking at some jaw surgery to kind of correct some of that. So yeah, super fun. So 28
scare
surgeries
them
and
so much,
counting.
Ingrid.
I know. Well, watch out. All right. No, I don't mean to scare you.
I'm just kidding with you.
It's been a wild and wacky ride, so glad to be here.
So we hope that we have a pretty good mix for you guys today, because we have 2 moms with 3-year-olds, a 13-year-old, a 16-year-old, 2 have received all your care in Cincinnati. Cole came when he was,
He was
7
7 months, so I
8 months
consider
old.
mostly.
And then Anna's pretty new to Cincinnati.
times, yeah, this is our
So
second
hopefully you have a good mix here of people who have known nothing but this hospital, and obviously that was pre-charge center, but some of the same doctors and then post. So does anyone have, if you have questions, our request is that you come up to the microphone, even if you have a loud voice, not that we can't hear you, but this will get recorded so that people who couldn't be at the conference can hear, and without it going through the mic system, that won't show up. So if people have questions you want to kick off, we can start that way, or I can introduce some topics. Does anyone have anything pressing? Okay, head to a microphone.
Nikki, you didn't tell us this would be recorded.
That's why you just signed that paper.
I'm curious what your record system looks like. Are you binder people, file people? What do you keep, what do you not keep? Do you have a separate hospital, separate school? I'm curious.
I'll take that. My husband is OCD, which is transferred to me. So his filing system, sometimes they overlap. If your kid is 3 and older, they're already in the school system, so you have IEP stuff to worry about and reports coming in from schools. So that is a different system than our medical system. Thankfully, Cincinnati Children's utilizes MyChart, so a lot of the information is on there, but anything we get paper-wise is scanned in. There are different programs depending on what software programs you use. If you're a Microsoft person, or if you're a Mac person, there's different things that you can use, and you can make different tabs within that organizational software. If you Google it, you can put stuff under tabs like pulmonology, cardiology. I like to keep all of his audiology stuff separate because that pertains a lot to what we're doing with his speech and with school. Unfortunately, a lot of school districts don't give you anything electronic, and scanning in hundreds and hundreds of school documents is kind of repetitive. So for that, we do utilize a binder with your typical college tabs and index, and so you can find everything. So it's kind of nice to actually have those separated, so you know what you're looking for and when you're looking for it.
So maybe Sean or Ingrid, you guys are a little further in the journey. Do you still keep everything, and how do you organize it?
I was just thinking I might need to purge some things because I have kept almost everything. But to play off her binder for the school, what I like about that, I used to file everything, but now I do binders for the IEPs and those type of things, because what I found is then I can take that to every meeting, and when they say, oh, that wasn't there, or we didn't test that, or whatever, I'm like, oh no, you did. Or this is what I have, and this is what you said. So it clears up that anything, if I don't have to rely on my memory, and I can just show them right there. So I really like that piece of it. And then, like she said, you get everything is paper. So I am not great on computers and organizing that way. So the rest of my system is files for the medical. So I have lots and lots of medical files, which probably some of which I'll keep. I still have a binder from the NICU, things like that. Probably don't need it anymore, but I still like to keep it. And then now that actually all his doctors, Cincinnati, and then we have doctors at home, do MyChart or a version of MyChart, and I love it. And so anytime we go to a new doctor, I print out his medical history and take it with me, and then just they can attach that, and I don't have to always fill out all of those forms, which I think is helpful. And so now I don't file anything because I just go to MyChart. So that was my system.
I had a medical binder that I carried around until it exceeded like 5 inches and was way too heavy. So before our last trip to Cincinnati earlier this year, I created folders by specialty, GI, neurology, et cetera, et cetera. And so I have everything filed by that, because most time when I go to a doctor, I don't need all of those. And then I can just take whichever ones I think pertain. And right now they're in my Ronald McDonald House bag. And so then I could just cart the whole thing, and that's how I keep it at home. My old stuff is still just everywhere around the house. So I'm not OCD. I mean, partially. Actually, our pediatrician says I am, but I don't think he can diagnose me. But as far as IEP stuff, I do have a binder and kind of a portable file system that I take to the meetings, because I do find the same, that they'll say, well, we don't have that. So Pinterest.
All right, Dr. Wiley, did you have a question?
Yeah, this is always my question because I recognize how many priorities there are, and how do you sort through what we think you ought to do and what you know is right, and kind of, I mean, I heard something about, well, they told us not to get rid of the G-tube, but we got rid of it anyway. I mean, how do you gauge, and I think that's fine, honestly, I'm the kind of person that, like, if it's time to be done, it's time to be done. But, I think it was I'll use my HIPAA badness, the Kaufmans who taught me, we left the NICU with more therapy requirements than you could possibly do in a week. So they recognized really early we were wrong. How do you help others kind of prioritize, talk back to their providers around, yeah, thank you, but no, just kind of, it's like a very nebulous question, but prioritization and communicating that in ways that people will line up with you and recognize that you got this.
I think there's probably two good points there. How do you prioritize? And then when you don't see eye to eye with a provider, do you have any tips on how to address that? So who wants to field those, one of the two or both first?
I can go first.
Okay.
I think for us, prioritizing therapies, we knew right away, like my son, he has a trach and a G-tube. I probably should have told you that. That's pretty big things, but obviously. He aspirated his secretion, so one of the things we had early on was a feeding therapy, which, wasn't, I didn't prioritize that as high as physical therapy or speech therapy, because if he aspirates his secretions, and we know that, he's not going to get anything more than 5 mLs by mouth, so let's put that on the back burner until focus on these other things like getting healthy lungs, that kind of thing before we move forward. And then sometimes, like last summer, we just stopped therapies for the summer. It's a lot, like I have an older son who doesn't want to go to therapies all the time. My charger, he doesn't want to go all the time. I don't want to go. Sometimes you just got to take a break and it's okay. Like, it's fine. We started back up when the school started. So, and then we did a lot of private therapies as well. But he gets services through school. So we stopped doing some of the private therapies that were redundant with the school therapies, at least for now, to see how he's doing with what he gets at school, and then we'll reevaluate next year and see how that goes. As far as like arguing with people or standing up for yourself, I'm really good at that. There's probably notes in my file at Children's. But I think, it's hard at first because you kind of have this mentality that the doctors went to school and they know, but your kid, you do. And I think that you just have to trust your gut, and if you don't think it's the right thing for right now, or if you think something's going on and something's going on even though you can't see it, like, you just keep pushing. I think as long as you are respectful and, most people will listen to you eventually. And if they don't, maybe it's not the right fit, and I think that's okay too. We had a doctor who wasn't the right fit for our family, and so we kindly just said thank you, but we're gonna find somebody else, and that worked out great. So
I think for when he was younger, the priorities were medical. Mm-hmm. It was stabilizing in care, keeping him safe, that was a survival mode. And we were thankful that our therapist at home told us to come to Cincinnati, because up to that point, when his trach was put in, they told us at home that, and I knew it wasn't right, I didn't know what to do about it, but they said, well, come back in a year and we'll take the trach out. And I was like, and I'm an occupational therapist by trade, but I hadn't had a lot of experience with trachs, but I just knew that, I'm not going to go back and you're telling me he can't breathe and then you're going to take the trach out. So I started researching, but his therapist pointed us in this direction. But one of the things that I think she touched on that's really important is finding the doctors, whether it's here or closer to home or where you're at, and the professionals that are really going to listen to you, because I think it's a true team. It's a problem solving. There's not one right answer. I get pieces from, and this is medical and educational, but I take pieces from all different people, and I'm a list person, so I'll make lists, like Liz, who's here, she's an occupational therapist and a good friend, and Cole's godmother. So we will sometimes go to dinner and I'll say, okay, I'm having trouble prioritizing, help me talk through the process. So having somebody And I do that with my husband too, but what right now is most important? And then if you have a team of doctors or a team of educators who are willing to work with you as a team, taking those pieces, and they can help you prioritize. And then there are things where I think it's called respectful disagreement. Typically, if I think that something's not right now, I'm a note person, so I take all my notes and I come in with all my stuff and tell them why I think it maybe isn't the best thing for him right now, but then get input and try to move from there.
I can say that for my son, he had 23 doctors, and so our pediatrician was through Cincinnati Children's, and they were very familiar with that, like, oh, that's no big deal. And he kind of taught me a really good thing. He would say, okay, let's look at the next 6 months, Nikki, what's most important? This is what I think, what do you think? And we would write like our 2 goals for the next 6 months, be it wean down the vent, be it see if the trach size needed to be changed, be it work on sitting, my son was pretty young when he passed, but we would make, okay, these are kind of our specialty, our big goal for the next 6 months. And I would go into and my husband and I would agree on it. I would go into every therapy appointment and every doctor's visit with that in my head. So if my goal was to wean down the vent and I went into ENT and they wanted to change a trach size, I would be like, hey, actually, I think that's probably important. Does this line up with that? Because I don't want to be changing the vent and his trach, and then we don't know which came first as a problem or holding us back. Is that okay with you? And so, I would always kind of set that stage before they tried to make a change and then it didn't work and we were backpedaling. Or say to speech therapy, hey, we're not going to do taste right now because I really want to work on this weaning the vent and I don't want him to get an infection and us not know what was the cause. So I think as a parent, that kind of helped me. Like, it was set. That was what, obviously something came up and trumped it, whatever, but I kind of went into every appointment with, these are our 2 goals for the next 6 months. Okay, now these are our 2 goals, and that helped me a lot. So I don't know if you have young kids. Mm-hmm. I found that when I had 40 things to do, I knew these were my top 2, because I think that can happen sometimes, and every specialist, no offense, thinks their issue is the most important and the most pressing. So I think if you're just respectful and you say, hey, as a team, this is where we're at, I seem to have really good luck with that strategy when you have that many balls in the air. So.
That sounds very wise. We also really like to only make one change at a time and kind of document it so we can see what is really affecting what. One of the early pieces of advice that I had was to ask yourself, is this person making money off my child? So you've got to kind of back up and go, what is the motivation here? So, and they can be very well intentioned, but you go to an occupational therapist or a physical therapist or whatever, their job is to sit there and assess your child, find out what can they fix. I'm not gonna say what's wrong with your child, what can they fix, and then what can you do? And so I would just look back at them and say, you just gave me 3 exercises to do 4 times a day. I still have laundry and another child, and I gave up cooking. So, this is not, and I see 4 other therapists, whatever. This is not physically possible. So please tell me the number 1 you want me to do, and I will do my best. So I am the kind of parent who doesn't mind vocalizing that. If you're not that kind of parent, what was it Tim said? Change. So, you've got to do that. So I think you also use other people as sounding boards, maybe other charge moms, I'm so confused. Maybe somebody who's a little bit farther along the experience can help with that.
Does anybody else want to comment as far as when you don't see eye to eye with a provider, or I think we covered the prioritizing pretty well. Do you?
I will say we have an exciting program in Oklahoma with our local medical school where they have a family class. Maybe you guys can do something similar in Cincinnati where maybe you do it. We get residents, we're getting residents. We've been waiting years to get my hands on them, but we have OTs and PTs that come out and they have to do a series of 3 visits to our house, and they look at our child, they look at our family life, they have to make a trip into the community with us, and so I always try to make it as involved as possible and just really let them see what life is like. So I'm so excited about the residents, but they need to see from the family perspective exactly what we go through.
And I will say one tip that I can say about not seeing eye to eye with a provider, we did get along very well. I still say, like, 23 doctors, I was close to 21 of them. That's a pretty good ratio. And like the form that I would communicate with them after my son was gone. So that to me is pretty good stats. But I would script something in my head for when I didn't agree with the provider so that I didn't misspeak in the heat of the moment when I didn't like what they were saying. So you have to tailor it to that, but I would have something very respectful, like, I hear what you're saying, and I know this is kind of your expertise, but in my experience with my son, I find this to be true. I hope that you can respect that. And I would always lead off with something like that was scripted. That way I'm not like, oh, really? Well, you don't know what you're saying, because in the moment, mama bear. So I would kind of check myself and start with that. And I found that to be very, very productive. So that's a tip that I can give to you for when you are in those situations. So, Stacia, you have a question?
It sounds like all of you guys have other boring siblings in addition to your charger. So how do you make a point to, A, give them special time so that they don't feel jealous? And what I'm struggling with is we've been able to successfully give our boring children special time, but we have somehow siloed the children so that they don't have a cross relationship between all of them. We have good, strong parent-to-child relationships, but how do you foster that together when they're so different?
And you have 3 boys, right?
Yeah,
Clarify.
3 boys. But 2 of them, we have twins, so one's our charger and then one's boring. And they don't seem to have the relationship that you would expect.
It's a challenge. If you've met Rachel, she is in no way boring. We always used to say Anna's our medically challenging child, but Rachel is our behaviorally challenging child. So she just is a high needs type person, high maintenance, and so people are like, how do you give her attention? I'm like, she demands it, so it really hasn't been a challenge in that way. But we tried to, Rachel, I was a stay-at-home mom. Well, I work-at-home mom, I guess. I teach music lessons and I play in symphonies, so my work schedule, my husband, I tag team parent. But we tried to balance Rachel's activities, so Anna had therapies and Rachel attended those, and we'd have to give her some attention during those times because she would not just play quietly on her own. But she had other activities. I mean, we did club volleyball. She had a lot of things that she did on her own that took a lot of time. And her sister went and watched her play club volleyball or whatever. So she had her own life. I highly recommend Sib Shops. If you have not looked into that in your area, it was very good for her. They have workshops at the international conference, but look that up in your area. Family therapy, their own therapy. I'm sure it's not a surprise to any of you that besides our own grief issues, your children are going to have grief issues. So just deal with it as quickly as you can. So pretending that it's not there is not going to help. So just try to communicate with them, be open. As far as fostering relationships, try to find common bonds they have, ways that they play. They kind of found their own way. A lot of it was nonverbal communication and play and silliness. Again, my girls are older, and once they got to the teen years, they were kind of doing their own thing, which is normal. They'd be around each other, but not as involved as they used to be. And we're at that age where we're looking at transition. And so trying to get Anna interested in employment and opportunities like that. So this summer we started a project where she is selling jewelry online through Origami Owl, because teens can do that. And so she and her sister are doing the social media marketing together. And so that's been a nice little project while Rachel's been at home. And Rachel enjoys social media, so that's, again, that kind of fits their wheel. So I'm always kind of looking for little things that can be kind of their thing. And also, Anna's had a lot of anxiety, and she's needed to do relaxation exercises. Well, Rachel has anxiety. So I assigned Rachel the job of working with Anna, breathing exercises. And Rachel's always been really good at getting Anna to do things we necessarily couldn't, or we, always couldn't motivate her to do. So please work with this on your sister. And I was like, maybe this will help Rachel too. Maybe she'll see the benefit. I hope she doesn't listen to this. She might see my master plan.
So I get what you're saying, because with a 5 and a 3-year-old, it's really hard. And I think part of the problem is us, because my daughter wanted to engage with him for a really long time, and me being the warrior I am, I'm like, don't knock him over, don't touch him, don't push him, don't do this, don't do that. So she got in this mentality of just leaving him alone and not interacting with him. So now I'm like backpedaling this year, and I've just kind of been leaving them alone to play together. I'll get out something I know they both want to do, like Play-Doh, and I just leave the room because I don't want to micromanage that relationship. I want them to interact with one another. So it's very intentional, and I think it kind of plays on what Dr. Wiley was saying too. You have to balance some priorities. Am I going to take him to physical therapy today, or does he need to spend time with his sister? Does he need to spend time with his dad? Does he need to do this? You know, is one half-an-hour session worth the 25-minute drive, or can he stay at home and play Play-Doh with his sister and build that bond? So I think everything is kind of intentional when you're prioritizing what affects like your daily life and your quality of life. And, you know, obviously if it's like the ENT is calling you like your child needs this because they can't breathe, then obviously that's a little bit more important than the physical therapist working with them for 30 minutes that day. So again, I made some mistakes with them, you know, kind of separating them at such an early age, and now I'm backpedaling because I want them to have that sibling bond. So it's very intentional, and it's something that we're struggling with too as a family that we're working on.
I think I agree, like, you know, you have this medically fragile child who the sibling wants to play with, but you're like, please, you know, you have to be careful if he falls down, like all these things. And then when Grayson was, really, it's only been in the last 6 to 8 months that he's been walking well and climbing and really like able to more communicate and socially interact with other kids and with his brother. So there's a lot more of that interaction now, which terrifies me because they're boys and they're 4 and 7 and their favorite activity is to sword fight. So I'm like, please stop swording your brother's face, or please keep the sword away from his trach, or, you know, can you not teach your brother how to slide face first down the slide? But so, you know, those kind of things. You just kind of have to like let it go and just be like, whatever, they're kids, like they're in the house, it's mostly safe. If you need to get stitches, probably not the first kid to ever have stitches. We were just there and had stitches the other day, so it's fine. You'll survive. But that's hard to do when your kid has been in the NICU and you're worried all the time. But it's kind of like you just gotta let it go and just let them be kids. And it's really a lot harder than you think. But if you are purposeful about it and think about it, like catch yourself, don't, you know, create that barrier, try not to as much as you can. I think that they can build those relationships.
And I think the main theme is trying to set them up for success. So, and I've really struggled with this because we are completely opposite. You know, Cole is older, he's 13, and then we decided to have Parker, and he is 4. So actually, Cole is pretty medically stable right now, but he has no idea his actual strength. So I'm more worried about him tackling and taking down Parker than I am Parker hurting Cole. So that's been an interesting dynamic. But initially, they did very well together. And then Cole has realized that Parker is very unpredictable. And Cole likes predictability. You know, just likes the predictability and needs that predictability. So I think that piece has been very, very good for Cole because Parker is so unpredictable. But then trying to make that balance, if Cole, you know, has had a long day, I try to make sure that he has his own time, he has breaks, that type of thing. But then setting it up in a time where Cole is receptive to Parker and he's in a good space, that's when I try to encourage them to play together either with something they like. And the interesting thing is, and this was just a function of me trying to get it done, is laundry. I make Cole put away his own laundry. Well, we all go in his room together, and what happened with that, Parker came in with me, and they started to play together. So I just kind of left it. So I think it's just given them those opportunities.
Okay, great.
I have a kind of a two-ish questions. First of all, out in public, when you're in a crowd and everything, and people, you know, notice the differences with your charger, how do you respond to that? Because on my not so admirable days, I want to say, take a picture, it lasts longer, quit staring. When Gabe doesn't have that many noticeable changes other than he's bigger, he's not walking, he's got Bajas, he's got AFOs. But how do you respond to that?
And then also, I don't remember, so if you want to go with that, maybe I'll remember.
I'll let you, the older parents take that first, because
It depends on the situation, because I think what I have noticed, there are people who are genuinely curious, genuinely caring, and I can see their face. And if it's that approach, and that's kind of why they're looking, a lot of times that's a nice opportunity to teach them about Cole. And it's even been times where he's had meltdowns in the store, and I've had people help us to get out. So those type of things. So I think there's a lot of people out there who really have good intentions, and some are able to foster that by helping, but some don't know what to do. So I try to use that as an opportunity to educate. I don't have the best strategies for those people who I think are just kind of staring and looking at me a lot of times, and probably early on I did say things, probably more under my breath, so it wasn't as noticeable. But now most of the time I just kind of take it as part of life. I don't really acknowledge them, because it's about what's going to be best for Cole. So if I'm G2 feeding him in a restaurant and people are looking and kind of, or he's acting out or something like that, I try to keep in mind that it's about Cole and our family and what's important, as opposed to, thinking I feel like I have enough to worry about than worrying about them. But it is hard, because a lot of times I do want to say something.
I was a lot more sensitive to it when Anna was younger, because you're probably realizing, like, going through this charge journey is like getting your skin slowly peeled off, right? Down to those very raw layers. But, and admittedly, I would have days where I'm just looking at him like, well, today's your day, and just let him rip. But mostly at this point, I try to be so present with my child, I don't notice it a lot. But if they're curious and they're kind, or I'll just, smile, and, again, you try to work with the education piece, because the more people you can add to your village, the better. You need as many as you can. If they're being rude, I'll certainly try to,
A lot
get
of
it back
times
on
I feel
track.
like if you just stare at them, you don't even have to say anything.
If they smile and wave,
look,
go on about your way.
And then they kind of, shuffle off.
There is a great Facebook site called, and it's a blog too, called Blessed by Brenna, and her daughter has a noticeable medical condition, and she writes not only about what goes on with her daughter, but she has a great book list about kindness and related things. And if you don't know, you can request that your local library get those kind of books, and so those get in your system, and hopefully parents check them out. You can request it at your local schools. So I would encourage you guys to do that. Just every effort, you needed one more thing on your list, but whatever we can do.
So this is a question more for folks with the Charge Foundation, because I have had families who have connected kids with autism who the Autism Society has made little cards, and you can hand them out and said, you just met a child with autism, next time you can. So I think that's a great strategy, because you also don't have to necessarily use your words. You can just kind of kindly hand off the card. So I think it would be really cool of a concept for, you have? Okay, so they're in development and they'll be distributed. That'll be great, because I really do think that that's a way to, when you're not feeling as bold, that you can still do some teaching without that.
I will say that when people would say things to my son, not so much they're just looking and stuff, I wouldn't interact with that, but if I heard, say a kid said, what's wrong with that boy? Because the ventilator draws a lot of attention. Why does that kid have his own TV with him all the time? Like on a hayride, and it's lighting up the whole wagon with a ventilator. So kids always ask, and the parents typically are the ones that are uncomfortable. And I say, oh no, that's fine, let me, and I would get very comfortable and say, well, let me tell you about it. This machine helps him breathe, blah, 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 and then you could see the parent get at ease, because I think the parent is more worried in that situation about offending you. So if you kind of just head that off and interact with the child, assuming they're close enough and it's appropriate, I found that to be a really good teaching opportunity, so that's something to think about too.
I saw a meme, something like that, where it says like, "Don't shush, ask questions" or something. So I tried to post those. I don't post much on Facebook. I'm more of a Facebook stalker. But yeah, I try to like forward those on my page because I'm like, I ask questions, but I remembered my second question. So on those rough days or just days when you're just overwhelmed and stuff, I had a couple charge moms, I don't want to point any fingers, but over, and and to try to like help with getting better self-talk for myself on those days where I'm just like, this isn't fair, my kid has had way too much to deal with, it's just a bad day. So what's some good self-talk that you use for yourself and or an outlet to help with?
Wine. Oh, sorry, my bad.
Got that. But yeah, an outlet that you use that might help with dealing with the life that we live. So
Sometimes I think on those days, I think it's okay to kind of grieve on those days, not the whole day, sometimes I have grieved the whole day, but I do think, sometimes we forget that is a natural part of the process, and even now, he's 13, but there are still things that sometimes will come up that might take me by surprise or hit me harder, and I think being okay, knowing that that's okay, and I think that's part of it, but then, not staying in that state too long is making sure, I start thinking about all the amazing, if you really think about I'll get emotional, but what he has done and accomplished, it's much more than we could have ever expected and thought. So when I really try to turn that around and think about, because we celebrate the smallest things, and we just do, because, and I try to celebrate Parker, my younger one, but it comes easier to him. So I think really there are a lot of miracles every day throughout his life that happen. So when I want to turn it around, trying to focus on that. And then I think the talk yesterday was really helpful for me. I took a lot of notes of the self-care and the breathing and things you can do in short periods of time. And then something that I like to do is either exercise or play tennis. So having a different outlet that is just for me. Sometimes schedules don't always allow it to work out, but when I can, my husband and I try to do that. His thing is golf and mine is tennis. But whatever that is, trying to find that something for yourself.
I would agree with that. I think, you have to have that little time. I'll go on a walk once the kids go to bed, take the dog for a walk. Even that little time just to yourself is helpful. And I also think, it's so easy to get bogged down on the, what is he going to do when he's 10 or 12 or 15? But I don't know what's going to happen with Wyatt, my typical child, when he's 10, 12, or 15. And it doesn't do me any good to worry about those things. So I try to just say to myself, it is what it is. This is where we are now. We've got a lot of good things. He's done a lot more than we ever thought he would. Let's just keep riding that. And, and it's okay to be sad for a little while, like you said, but then you kind of just have to look at where you're at and, what's going well and kind of focus on that and just move forward and put it aside.
To do with relationships with your husband or your partner. Because what I find now for me is that Jackson's out of the hospital and we spend our days focused so much on him and then my other child, and then my brain has this much left of it, and sometimes I completely forget that I also have a husband. And so what kind of strategies, things do you guys do to kind of remind yourself, or things you try to do together that maybe allow you to maybe for a moment kind of, I not forget the kids, but just be in the moment with each other versus, we'll go out to dinner, but we spend our dinner talking about oh my God, so Jackson has a surgery coming up, and we have this to do, and oh my gosh, and now starts school, and we forget to actually talk about us, I guess. Yeah.
We're all yeah.
That sounds about right.
I can tell you that for my husband and I, we had about 20 minutes between when our son was down, probably about 35, our son was down for the night, no more procedures, medicines, and then till the night nurse got there. And so we couldn't go to bed, which would be the automatic because we were exhausted. So we would sit on the couch and we would DVR something and watch it, which would take about 25 of the 35 minutes, and then we would talk about it for the next 10 minutes, which sounds really dumb, but I had nothing else to talk about except what I did all day. And he had work, but we only want to talk about that so much. So we were kind of at a loss for what's going on in the world. Oh, who knows? Or going on in our world is this, that we would talk about a silly show for 10 minutes, but it was something totally checked out from what we did every day. So we would find not the most ridiculous, but something that was far from our reality to watch, and then we could share those few minutes kind of talking about it, because you could veg out during it, which was nice. My brain could check out, and then you could re-engage. It was a very short time, but for the year that we did that, that was our only real good, because we'd go to dinner like, okay, we have a dinner, and it's like, okay, we got to get back. I wonder if the night nurse did this. I wonder if my mom's okay, and what do we have tomorrow? And it was like, well, yeah, we did eat, but we didn't really talk to each other. So that was the only really strategy we found during that year. I don't know what you guys can say.
I do think going out to dinner with other couples will help, or other people, because then, you can't focus on just your child, and you'll talk about other things going on in the world, and I find out things that I didn't know were going on in the world. So that's nice. But I do think sometimes we don't even always talk about it, but I think just being present, and if there is a time where we sit there and veg out and watch TV together, that's kind of the day-to-day thing, because it is something that's not. And then for the bigger things, when you go out, I think trying to go out and reconnect with people is kind of nice.
You guys have any tips down there?
I would never want to purport to be an expert on this. So if there is an expert in the house, perhaps the next conference you could speak on this. But I would say, obviously, if you feel like you need therapy, get it soon. Do their advice, because, the stronger your marriage is, the better equipped you'll be for this journey. But I know, things that are recommended that we don't always follow would be to have your family meeting time to talk about those things you need to get done. And then when you do get to go out, no talk about that. You've got to, and if you can delegate it to your husband, because I know we moms tend to run, again, Hartshorn household may have been different, but we moms tend to run the schedule, the medical appointments, all of that. If you can delegate it to your husband to plan the date and taking you out of that role, and okay, I've got to take care of you in this way, and you just need to be wife right now. So, and try to plan some time off.
That's a good suggestion.
And we used to do staycations. We were pretty good about that. Anna takes daily growth hormone shots. We've never had nursing. So we used to go stay at a hotel in town, and we had babysitters who could take care of the kids, but we'd have to go home every day to do the shots. So we used to do that, but we gave that up. So.
And I would just add, if you can build a support system around you where it's hard to leave your kid with just anybody. Like, I get it. Like, you don't, but, find somebody that you trust who can watch your kids, and that they're going to be safe, and then just go, and your kids are, like, my parents are good at that, and my husband's mom is good at that, and we actually have another babysitter that she is applying to nursing school, and we just found her through advertising at the local nursing school, and she came and we trained her on Grayson's Care, and she stayed there while I was there and took care of him, so we made sure we were comfortable. And so we've had her for 2 years now. And so if parents can't take care of the kids, we call her, and she comes and she babysits. Now I do pay her a premium because he's medically fragile. So it is a little cost to that. But if you can, I would encourage you to do something like that and kind of let go of the reins a little bit. Because I think if you know that you have somebody at home with your kid who can take care of them, it's much easier to step back and, take that break.
And there may be programs, they're different state to state, but there are sometimes waiver programs that will help with some of the cost of, respite and things like that, which is nice. And then I think going to different schools, we've been able to get some of his care providers through occupational therapy. So if you have local schools like nursing, PT, OT, speech, a lot of times those students are interested.
I wanted to mention something too. I think that Amy had asked before about like when you're having a bad day and how's your support and stuff. Like if there's anyone here who's not connected with other charge moms, I think that's such a resource because like I can vent to my best friend since kindergarten, but she would have no idea. I mean, what is she going to say back? Like, you know what I mean? So when you have those bad days with someone who really can get it, then I think you can vent to them. But they are also going to be the first to help you check back in about, but look what he or she's doing. And, you know, so no, you might not be able to drive to their house, but there's obviously online on Facebook, the charge group. But now, if you don't know, there's so many subsets of that you can be connected with people who the kids are more your child's age, or like me and some of the moms, we have just our own messenger chats in that are always set up. Like there's a group of 4 of us. When someone's having a bad day, you fire that and you're going to get 3 responses. So I think if you can kind of build a little tribe that way, that's not as, you know, you don't want to paste everything in the charge page when you're having a bad day, but you find your kind of group that can be very therapeutic. I mean, I don't know if you guys can speak to that, but I think that is really helpful. And if you get the chance, especially at a conference like here, or you go to the international conference and you meet a mom that you kind of connect with, find a way that you guys can text or you can shoot, you know, I mean, the moms I connect with are all over the country, so it might be 2 a.m, but there's going to be a response when I wake up, which is always nice. So I don't know if you guys have any more to add. But
I echo that. I have my own mom squad, and I think there's 6 of us in that group, and we're all across the country. And when we started it, we were just making jokes because we were all up late one night, and but it's become invaluable over the last 3 years. And I think I'd only met one of them in person when we started that, and now I've met all but one in person. But you know, when you talk to other charge moms, you don't have to explain about G-tube feeding, or, you know, you just start with such a common knowledge. It's very like, oh, I just, you know, let my hair down right now. And so you have that common medical and educational basis, but also I really encourage you to consider a multi-age kind of group, because you all have such different experiences. You know, older moms can mentor you on stuff that you haven't been through yet, but I learned stuff from younger moms too, because there's new stuff coming out, right? So consider that. I mean, I do like the, you know, young parents group, but I think sometimes you're missing some of the wisdom that you can get from the older moms, or some of the things that are, you know, it's coming down the tracks towards you. So I think that's great. And for me, it provides humor and heart, and like she mentioned, just the hours help too, because you never know who's up across the country. So.
Hi, my little girl is 5, and when she was in the NICU for 16 weeks, we brought her home for 10 weeks, and we were back in the PICU for 12 weeks, and she had just got a common cold, like maybe like the sniffles for us, but for her it was, she was put on ECMO, and so so when she came back home, it was just like, nobody ever comes into this house without taking off their clothes and taking off their shoes and taking, you know, go shower before you come and see her into her room. So that was our life for, I would say, about 3 years for sure. And then about 2 years ago, less doctor visits, and so and anytime she ever went out was to the doctor, and that was it. We never took her to a restaurant, never took her to the store, never did anything. So about 2 years ago, when she turned 4, well, actually last year, when she turned 4, we started taking her out. And it was just one visit to one little store where there wasn't a lot of people, and it went well. So the next time, and of course it's only just me that takes her out, or me and my daughter, we'd go as a team. But my husband, he's just like, he doesn't want to, and he never ventures out to take her anywhere. But so now I take her everywhere. We go to Sam's, we go to Michael's, and I mean, so now it's like and so less doctor visits, so she doesn't get sick as much. But the other day we went to the doctor, we had a visit here in Cincinnati, and we're in the bathroom, and it was time to wash our hands. Well, she puts that tongue everywhere, every single place, and she put it on the sink. I mean, and so then, so I had the suds, and she puts the suds on her tongue, and so she doesn't taste anything. But my fear is she's going to start school in a few weeks. My fear is the germs of the school. And of course, my husband says, oh, she's definitely going to get sick. This isn't going to last at all. I said, and I'm optimistic. Like, I think it's going to work. She's going to be okay. But how do you all deal, or have you dealt with your children and the germs and going to school?
I'm going to take point on that because there's actually somebody here from my son's school today laughing at me. So my son he'll be 4 in September, and I was the same way. I had hand sanitizer pumps installed by my front door. If you were around anybody who even sneezed, I don't care if you thought it was allergies, you could not come to my house. I didn't let people touch him. I was because we got out of the hospital, we ended up right back in there with RSV, and we were in the PICU, and then we ended up in there, and he tested actually negative for all the viruses, and there was still, they're talking about intubating him, and I thought I was going to lose my mind, and I was like, okay, after like the 3rd time that he was hospitalized for what we think is a common cold, I got really, just like your life was like mine. That's what you described was my life. But with my son being able to utilize his hearing aid and his implant, we were really hopeful for oral speech. So we are blessed here in Cincinnati because we have an oral speech school that is infant through 2nd grade. So I finally prioritized that because I put it off for a really long time. I knew it was there since he was a baby, but before he was 2, I finally decided to go there to see if he had the possibility of speech. He started in their toddler program, and I watched somebody make a snack without washing their hands, and I lost my mind that day. I talked to the director, I talked to the co-director, I talked to everybody, like, this isn't okay. And the first time he got sick, I was really upset with the school. And then as he became older and his airway became bigger, and his immune system started to kind of compensate for some of that, I got less and less anxious about it, and just kind of was like, it's a part of life. Our kids are going to get sick. Yeah, it's going to look really bad for us. It's going to look really bad for my 3-year-old than it is for my 5-year-old. And obviously, I still take a lot of precautions. You just talk to the teachers, like, hey, if little Joe over there is coughing, I want him away from him today. Put him on the other side of the classroom. Let's focus on hand hygiene. I feel like schools have been really receptive to me just talking to them about charge syndrome and about my expectations with hand hygiene and people who are sick. And yeah, he's gotten sick. He licked the mat when we were at vestibular therapy, and he had a fever of 104 for 3 days after that. So they're going to get sick, and it's just going to be a part of our lives that we kind of have to compensate for. But I think that schools particularly are really receptive to kind of listening to you about hand hygiene, about your expectations with other kids who are sick, and what your expectations for your child is. So
I just want to add, my son just started school in January, which is not a great time for anyone to go to school, but he actually did better than I thought. But I did ask the school, I mean, I know they don't know when everyone is sick, but I'm like, if you have cases of the flu or something that's highly contagious, like hand, foot, and mouth, like that's all over all the time. I'm like, could you just send me an email? You don't have to tell me who it is, where it's at in the school. I would just like to know so then I can make the decision. I'm going to keep Grayson home from school for 2 or 3 days, the rest of the week, whatever, just to kind of have a little bit of control as best you can in that situation, because you can't control everything unless they're in a bubble, and that's not fun for you or them. So that's kind of helped me. And with my older son, he goes to a different school. They had the flu. A lot of kids had the flu there, so we kept him home for 2 days just to make sure he wasn't exposed to bringing home to Grayson. So I think you just kind of balance reality with, what you need as best you can.
So we're in high school, and we have a health plan, and we've had it since elementary school because she does have an immune disorder, and it's administered by the nurse, and it's part of her 504/IEP. And we have doctor's letters from our pediatrician, immunologist, endocrinologist, is that it? That have orders on what they're supposed to do. So contact your local parent training information center, which is a federally funded place in all of your states. So I encourage you to look into that, and they can help you with that.
Is it separate from the IEP, the health plan?
It really shouldn't be. There should be accountability for it on who carries it out.
Okay.
Okay. Before I ask any questions, do you guys have anything that you want to share or that even bring to discussion with the other moms?
I mean, Robin and I were talking about, so once you turn 3 in the state of Ohio, you age out, or in even Kentucky, you age out of like the county program. So whatever services you're getting through your state or your county, you age out, and you start the IEP process at 3, no matter if your kid's going to preschool or not. So if anybody is interested in that, like Robin had a really good experience with her IEP plan, and I had not a negative. I had a lot of trouble with our IEP. So we have a lot of information on that if anybody is interested in IEP talks, if your kids are getting close to that, or if you've already been through it and have expertise you guys want to share with that, or if you guys want to talk about another subject, Nikki, that's fine too.
Your Kentucky and Ohio Deafblind Project people here today too, but feel free to talk more about that, because I think that transition is really challenging, because you're kind of in charge in the birth to 3, and then at school, the school's in charge, and so it's a very different dynamic. But if people have specific questions, I'm just going to put the resources who are here.
Yeah, could y'all raise your hands?
Yeah.
Yeah, thank you.
So maybe,
I had one more thing.
well, you have a different school experience, so that might be helpful,
yeah,
but maybe
so-
if you guys have any tips for the other parents about IEPs, that this is something that, obviously without going into extensive detail, and if people want to pull you guys aside later and maybe pair up with the deafblind advocates here, but if you guys have any tips, or Sean, I know, like I said, you have a different school experience, so.
Cole started off in his school experience was fantastic, and then we tried a lot of different things, and it just didn't work out for him. But what is working really well, so if anybody had any questions about it, is homeschooling, and we've developed a network of very supportive parents who homeschool, and a lot of them, their kids have other, not charge syndrome, but other special needs, and so it's been wonderful, and he is thriving in that environment. And then the other thing, when they brought up the deafblind projects, one of the things I think looking back that I could have done differently that may have helped his school be more successful once he transitioned from his program that went through kindergarten, and now there's a lot more out there on it than there was then, is having an intervener. And he is, and I never thought about that, because he signed amazingly well, so I thought of it as only for communication. And he was also verbal, and so I think, but a lot of his behaviors were misunderstood because they didn't understand what, like what they were talking about earlier, why he was doing them, and I think an intervener could have really helped with that, and that's, I think that maybe would have made a difference for him. But if you have questions about homeschool too, I love it, and he does fantastic.
So I'll finish the school. I agree. I wish Erin has had, she's been in a self-contained deaf ed classroom, and then once the immune disorder started, it's been a combination of part-time school and homebound with a deaf educator. She's had paraprofessionals and interpreters, but I also agree that an intervener would have been helpful, and I feel like we've missed the deafblind boat because, well, it's just really very almost non-existent in Oklahoma, and there's no interveners in the state. They fought for one in a nearby community, and then that family gave it up in favor of an interpreter, and anyway, long story. So Oklahoma's just behind in that regard. But regarding the schools, contact the Deafblind Project, contact your PTI, go to training before you need it. I know there's always too many things to do, but when you see a training, it's a lot to take in. It's a whole new set of acronyms, FAPE, LRE. I mean, it's just, yeah, it's going to be a lot. So the more you can ease into it, go to all the free trainings. Wright's Law is good. If you're really serious about it, there's I forget how long it is, but there's an intensive training at William and Mary College, and there's a scholarship every year named after the director from Oklahoma from our Disability Law Center. So you can apply for that if you really want to do that. So, and we do have some people through the Charge Syndrome Foundation who've had a lot of experience with that we can connect you with. My husband's on the board, not him, but somebody else there if you need some extra help. But go through all these other avenues that are already federally funded and paid for you. So good luck. Oh, and yeah, there are Facebook blogs on this too, so Pinterest.
Maybe one question I think that people had some different insight last time we had the parent panel is if there was one bit of information for you guys to share right now with other parents that are maybe in a similar or earlier stage, which, I mean, 3 sounds early, but if we all know that first year sounds like a lifetime. So you are far compared to some people. What would maybe be one piece of advice that you could share or one thing that you wish you had done differently for where you're at right now? I mean, that can change as they get older, but in your current status.
I would say to try to begin with the end in mind. Again, it's really hard because you're in the weeds and there's so much to do every day, and I'm constantly overwhelmed, and I'm a huge list maker. But like in the case of education, which we were just speaking about, you know, things might be okay now, but I promise you it gets more intense as you move on to middle school or high school. Or I just got an email that the administrator we've been fortunate enough to work with for 3 years, even though it hasn't been great, she's leaving. And so our special education director who's only been there 2 years, is on medical leave. I mean, so we're constantly training new administrators, new teachers. I mean, it seems to happen a lot more rapidly the older they get. So even if your situation is great now, you may need to look down, well, okay, I like my elementary school, but what does the middle school look like? What does the high school look like? How are the students doing that are graduating from that? You know, I've talked with some parents here who aren't tied to where they're living. Well, you know, what does this look like down the future for my child? What are your medical insurance benefits? What are the state Medicaid benefits? You know, there are waiting lists in a lot of states. You can't just pick up and move to any state that you want because you might be on a 10-year waiting list, so you need to take that into consideration. What do you want from your family life? What do you want? You need to build a village. What's going to happen beyond your life? Do you have some written goals? I saw someone on Facebook had written out some very coherent goals for her son's life, and it was really beautiful. I don't have anything that coherent, but it would be great to know this is what we're aiming for. So if you have that target, then you can start streamlining your life towards that.
One thing that I wish I would have done a little differently is reach out to the community that I was given the information for early on. I was very self-contained with my son after we got home, and I didn't reach out to the charge community or other charge mom. It took me months. Actually, our regional infant hearing person knew somebody in the area. She gave me her number multiple times, and it took me a few months to actually get the courage to call her, and I feel like I just cried on the phone for an hour before we actually talked. And then her daughter is 5 years older, 4 years older. Why can't I ever remember? 3 years older than my son, and it's amazing. Even if I've known her for 3 years now, and this is the first time I've seen her in person, but it's just that amazing connection that you can have with somebody without meeting them. And I wish I would have buckled down and did that sooner and got that community of moms on my side before I embarked on this journey, because it's, you know, you can't, you and your partner are equally as stressed, and I don't feel like you can be the sounding board for one another constantly, because that might kind of wear down on your relationship. So I think you need those other sounding boards early on in life. So if you're new at this, get your sounding boards early, get that community, even if they're not other charge moms or even if they're across the country, just go ahead and do it early on and not wait.
I think one thing that has been important for me is to just let him be a kid. Like, don't be so focused on the medical. He's little, he's a kid, let him be a kid. Sorry. That's my advice. Sorry.
I don't know. I think they said it very well, but I think you're very right on letting them be a kid. And something that I have learned a lot recently from, which has been really nice, and it goes back to creating that community within charge, but also within your own community, is he has a therapist right now who is an art therapist. He hates art. He doesn't do very well with fine motor. So I thought, oh, this is not really going to work out. But she sets him up for success, and she appreciates him right now for who he is without ever changing him. Not that I'm not always reaching for other goals, but embracing where he is at this moment. And it's hard to do, but trying to do that, because you're always, looking for the next step. And then something else that you had mentioned that I think was really helpful with the Deaf Blind Project, they can help you because you're always training new people, and that gets tiring in new schools, is they were very helpful in training a lot of people for us. And then I kept a binder of, and I still have it, of when I go to train someone new, whether it's through education or coming into the home. Those things were helpful.
Sure.
Go and visit your school. If you're in the public school and your child's only 3.5, 4 years old, go see the school. Don't let the first time they see you is when they do like kindergarten orientation. The reason I say that is planning. There is incredible turnover in the public school system. My wife's a principal at a suburban district outside Columbus. She has a good contact with the local, like Help Me Grow, the sort of birth to 3. So she has some idea of what's coming, and then she can make plans for staffing in the building, okay? This does come down to dollar and cents. You know, I hate to say that, but it's true. And districts will have to make adjustments on the fly to hire different people. You know, say after, there's this magic date of July 10th, right? School contracts are locked in on July 10th. You know, so decisions are made for the upcoming school year, in some cases 2 months before school starts. And then school districts have to scramble. It's a very odd thing. Secondly, when you go into that world and you go from Part C is the federal law that governs birth to 3. Once you move into Part B, school age, okay, there's a bazillion acronyms around IEPs, ITR, blah, 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 blah. There is so much documentation out on the web. I know that your plate is full, but you're about to enter a system that is daunting. You go into an IEP meeting, you'll be sitting there staring at a panel like this with a bunch of folks that think they know what they're talking about. And a lot of times people will accept what they say. Here's what we can offer. Here's what we can offer you. That may or may not be right. May or may not be right. IDEA says what the child is entitled to, and the district has to pay for it. Okay? You all know, I mean, it's dollars and cents, unfortunately. Okay? And don't, trust me, decisions are made looking at the bottom line, not what's always in the best thing of the child, but give the district a heads up on this is my child, it's going to be coming, we're looking forward to it. Start to establish a relationship that can start to plant the seed of what's coming down the line. Ask them, what are the qualifications of the people that will be working with my child? Have they worked with dual sensory disabilities? How often will they see a VI teacher and HI teacher? Ask those questions then, not 2 months before the child's supposed to be in kindergarten or first grade or whatever.
That's great advice, yeah. I hadn't heard that before, but go ahead of time and establish that relationship and kind of warn them what's coming, and that way you can read up and be informed and prepared, and they have some little heads up.
So my question is, as a social interaction, like taking your kid out of the home, we haven't really left the home in 2 years. Like, we go to school, but that's with the nurse. Feeding times and feedings, they get in the way. It's like easier just to stay home and do those things with Olivia there. Like, how do you guys start to, as the kid gets older, how did you guys start getting out of the home?
How old is your daughter?
2.
Okay.
We have play dates at our house. That's how we started. We would invite people over and I would ask them ahead of time, like, is everybody in the house healthy? Does anybody have a cold, runny nose, cough, GI symptoms, fever? Kind of go through the list. If not, invite them over to your house at first and kind of establish that. And then you slowly kind of venture out after there is kind of what we did. And it's still hard for me to do that, but I work on it because it's not fair for you guys or your kids to be homebound all the time. But it is more comfortable at first, especially when she does have those feeds and she does have everything else going on, to invite people over to your house to play first and then move on from there.
Oh, go ahead.
I think sometimes we would just go to like an early dinner, you know, because if the feed was at 6, you go eat at 4:30, you know, get the early bird special, whatever, and come back home and do your feeds there, especially if they're on the pump. Now Grayson is on, just does bolus feeds, and that makes it a lot easier. You just, you know, literally wherever, the shopping cart, I don't know, soccer, whatever, you just kind of do it. And you get more comfortable the more you go out and do it. And I also think for us, we were fortunate in that our older son was a typical kid, and so he had school, and he had soccer, and he had baseball, and so we were forced to do those things. It's like we can't just keep him, you know, at home all the time too. He wants to do baseball, he wants to do basketball, so you have to go out with him. So that kind of helped us a little bit, but even at the beginning, it was still like, oh my gosh, this is a lot of stuff. It's a suction machine, it's a, you know, feeding pump, it's all of these things, but you kind of work around it. And then I think if you go a few times, it starts to get easier, and the more you do it, the more used to it you get, and then all of a sudden you're like whipping out like a syringe in the middle of Target, you know, and it explodes everywhere, and you're like, well, that sucks, and you clean it up and you go on and buy your diapers, whatever. You know, it just becomes like your life, and then you know, you think back and you're like, remember when we would go to dinner at like 3:30 or 4, you know, and you're like, gosh, but I think the more you do it, the easier it gets.
I would say I would just encourage you to make yourself do it. If it's something you're missing, if you're not, then hang out at home. Who cares? Like with my son, I'm like, okay, my husband cannot stay home or he isn't fun. So to me, it was like I could just stay home and chill and do it all. But I'm like, all right, we got to figure out how I'm going to straight cath you in a sterile environment at Target. Okay, in the back of the car. So we just would pick ourselves, because you have so many things you have to do with appointments and stuff, that we would pick one social thing we didn't have to do but wanted to do every week. And we started with one thing, and the prep and the pack up and was a lot, and the questions you get when you're doing stuff. But I mean, you'd be amazed. I mean, we had a ventilator, we had a continuous feeds. Once you do it, we look back now and we think when we got trained on that, it was like this procedure with everything. And now we would be like, hey, can you throw me a new trach? Okay, cool. Like, you know, when we were gotten really good at it. So I would just say, set yourself a goal, whatever is appropriate for you, and then make yourself do it. And you'll be amazed how quick you become comfortable and how you do learn to flex a schedule, to hold a feed 15 minutes and realize it'll be okay, or, you know, whatever. So
It's true.
I agree. It's really, most of the times our kids don't care. It's our hang up. So we need to get over it. And I'm going to say my friend Rachel Collins is killing it over here. Raise your hand.
I know.
So go peek in her bag and you can see how she's managing the feeds.
So I just wanted to add another resource. So I know we touched a little bit on interveners. You can go to NCDB, National Center on Deaf Blindness. They have this wonderful 27 module on open hands, open access that's available to anybody. So that's something that everyone can have access to. Another thing we talked about was IEPs. And when Sean was talking, it brought back memories of us going to meetings. You can always ask your deafblind project to go with you. It's really nice to have someone sitting with you in a cast of a million, especially when they're using all those big acronyms. And sometimes just having someone there with the parent helps a little bit for more leverage. Also, a lot of times I would tell Sean, don't worry about notes. I'm going to take copious notes for you, and they'll be yours for afterwards. And then I was also sitting next to Sarah, who mentioned also that it's important to get everything in that document, because if your director of special ed leaves, if the teacher leaves, if you move, you need to have it in that document to support your child.
And then the other thing is, I don't really want to open up a can of whip bottom, but we use the ADA Act to secure an intervener. The Americans with Disability Act of 1990 secures that every student should have access to communication, an interpreter, as it were. Now, our kids are deaf-blind, and a lot of times they'll try to mask that with disabled, and, well, it just can't be taught. But if you can go back to the nucleus of that law, and, most of your kids or a lot of them, have a significant hearing impairment, then that can secure that one-on-one that you can need. And then you can work it from there. But basically, my school didn't recognize it until I pulled out that law. And now we officially have the verbal documentation for an intervener.
What was your name?
She wants to know what her name is. Oh.
Okay, if there aren't any questions, it's about lunchtime, so we're probably going to break. If you guys do have questions for parents that are around, I was kind of joking with Michelle earlier, but like if you've seen her bag of tricks that she's keeping Jake occupied with, it's amazing.
Oh, I've been watching and
So
taking notes.
if you see a parent like that and you're thinking, how? I mean, he's been sitting here like an angel for 2 days. Like, that's amazing. She's obviously done this along. Talk to her. Talk to Rachel. I mean, Litsy's everywhere. Like, you guys take her where you go. And she has to. So talk to her, or like, hey, that chair's pretty sweet. What did you do to get that? How did you do that? I think everybody in this room is going to be more than willing to share with you what they've learned. Then save yourself a little bit of that research, that fight. So don't be afraid to talk to these moms or dads and connect with them and then get some tips from them.